excited to bring you evidence-based nutrition information focusing on addressing the root cause for imbalance. Food has the power to help you achieve lifelong optimal health without the side effects of prescription medication. Subscribe on Apple Podcasts, Spotify, or any other podcast platform. I am Stacy Seslowsky, functional nutrition registered dietitian.
And I am Leah Grace Barrick, functional nutritionist.
Hi, everyone. Welcome to the Power of Food podcast, episode number 10. We are so excited. This is our 10th episode, and we have a very special guest on today, Dr. Angela Cortal, to talk all about joint health and really getting to the root cause of joint issues. So we're so excited to have Dr. Angela on today. Stacy's going to go ahead and give you guys her bio so we can get right to it.
Dr. Angela Cortal is a naturopathic physician based in Oregon and a best-selling author of Younger Joints Today. She is passionate about reversing degenerative joint disease by addressing the root causes. She loves partnering with her patients to optimize their health, happiness, strength, and well-being. Her story began with a debilitating knee injury that resulted in years of chronic pain. Feeling stuck and out of options. In Younger Joints Today, Dr. Angela shares her evidence-informed 7-step plan to address the root cause of chronic joint pain. This exact framework has a proven track record of years of clinical practice, as well as being used to reverse her own chronic joint pain. In addition to her clinical practice, she is a sought-after teacher focusing on addressing joint pain, instructs advanced injection skill courses for physicians, and lectures to professional audiences on hormones, joint health, and injection therapies. In her spare time, she tends to her rural property with her husband, Zavi, and their 2 rescue dogs, Levi and Frankie. So welcome, Dr. Angela. How are you doing today?
I'm doing wonderful, and thank you so much. I'm very excited to be here for your 10th episode.
Awesome. Well, we're so excited to have you on, and there's so much we want to cover today. So let's just dive right in and really talk about, just general joint pain, which you talk a lot about. You experienced it yourself. Can you let our audience know a little bit more about what specific conditions you're referring to when you talk about joint pain?
Yeah. So I'd say by and large, the most common diagnosis that someone gets if they go to just their primary care or any other general practitioner, they have joint pain. It's been lasting for a while. That could be months or years. And the most common diagnosis there is osteoarthritis or degenerative joint disease. A lot of people know about getting x-rays or perhaps MRIs and the cartilage thinning. And if it's very severe, then people are told it's bone on bone. So a lot of people know that, bone on bone, that's really bad. So they're kind of aware of that severe case there, but it can have a lot of different types of presentations. Generally, it's pain or clicking, giving out, swelling. Sometimes there's bony formations there. So osteoarthritis or degenerative joint disease is the most common in the US. It's about a quarter of the adults will have or will get that diagnosis. So yeah, a lot of people out there are affected by that. In my case, as you mentioned, with my knee injury, and then I had surgery. So my issues were actually coming on in my 20s, in my early 20s, actually. So I wasn't necessarily that classic case of it, that sort of pain and weakness and instability building up over decades. I got the accelerated course, accelerated path for myself. And, but I also see a lot of patients who fit this sort of label with maybe a chronic sports injury or car accident, a repetitive injury, maybe their work duties or a hobby or something is putting a lot of stress. For example, if I have patients that do like overhead work, maybe like mechanical type of work or something, they just wear out their shoulders way faster than your average person. So anywhere from joint, ligament, tendon, a lot of different structural issues can be sort of at the root of that chronic joint pain.
What I love so much about this topic is that I feel when people have this type of pain, they really feel at a loss of what to do. There are so many other things that we could Google and say, okay, eat this or do this, and it will help. But when it comes to joint pain, I just feel like there's so much confusion. So maybe you can talk a little bit more about what is typically recommended for people that are experiencing this.
Yeah, and I share your concern because I feel like there's some recommendations often given kind of right off the bat, like the first time you go to the doctor and say my knee or my hip has been hurting for a long time, they have some recommendations. Usually it's ibuprofen or some other type of non-steroidal anti-inflammatory medication, over the counter or prescription. Patients are often given a physical therapy referral, which can help for a lot of people. But as we'll talk through more, there's a lot of reasons behind joint pain. And if it isn't just the sort of strength and range of motion component that's often addressed in physical therapy, they'll go back to their doctor and say, I'm not sure if that physical therapy worked or it helped and then came back. And so I feel like in that standard of care model, they have a few recommendations to give right off. And then if that doesn't work, then it's like, okay, let's refer you to orthopedic surgery and see if there's something to be cut out. I just feel like we're going from 0 to 60 there and nothing in between, and not really any discussion about why, where's this coming from, what factors can we address for you. It's just, here's the pills, here's the physical therapy, and then surgery.
Totally. Yeah. And I feel like with that, they just kind of put everyone in one box. And like you said, oftentimes they're giving ibuprofen, which then can cause many other issues, including gut issues, contribute to the inflammation that we're trying to get down in the first place. And then, like you said, if that doesn't work with a physical therapy, going straight to surgery, which is very invasive and expensive. And, we're going to talk more about this, but isn't people's only option. So I'm really glad we're going to cover that. So if those don't work, then what options do people have?
Well, I have a lot to say on this topic, my whole book. And so jumping off that sort of initial treatment plan, and patients are often labeled as like they've failed conservative treatment, they've failed the ibuprofen, they've failed the physical therapy because they don't feel it's working for them, or they're having a lot more side effects like gastritis, inflammation of the stomach lining, GI issues, like with ibuprofen, especially with a lot of the recommendations I see where patients coming to me are on like 800 milligrams of ibuprofen twice a day indefinitely. Like that's just the plan.
Oh my gosh.
And that doesn't make a lot of sense to me if there's something else going on that we can actually identify and change. And so just kind of the big picture view of how I go through that is figuring out like what someone's source of joint pain. Not everyone with knee pain, shoulder pain, hip pain is going to have the same actual, like the source of where the pain is coming from. For some people, yes, they could have a degeneration of that cartilage, the sort of rolling surfaces inside of the joint that could be causing their pain. But for someone else, and I particularly see this a lot with patients that have a sort of like a traumatic accident, whether it's a car accident, or I have a number of patients that have fallen off of horses or ladders, or a pain that starts after that. Maybe it's a partial tear of a muscle, tendon, ligament, something like that. So just saying, here's some ibuprofen isn't going to be really getting anyone any long-term change in what's going on. It just dampens the immune system. It dampens those pain signals in the moment. But then going on from there, nutrition is a big piece of what I look at. But then other things like just lifestyle factors, hormonal factors, kind of metabolic health. I like to pull in all the actual sort of functional medicine pieces that we know can positively affect a joint health that just aren't usually.
Yeah, I really would love to hear what your nutrition recommendations are and what some of those recommendations are. And then what I also really love about what you just said is how I'm sure what you are going to recommend to people will really depend on that root cause, right? We always we realize that one of the big differences between functional medicine and conventional medicine is identifying that root cause, and rather than just treating the symptoms, we want to address, what is actually causing that issue from the start. So maybe you just talk about, some of those root causes and then how that would change your recommendations for people.
Yeah, definitely. So jumping off what I was saying with metabolic disease, I do want to get a sense of whether or not that's a relevant part of someone's medical history. So the overlap between osteoarthritis and our sort of metabolic syndrome type of conditions, such as prediabetes, diabetes, high blood pressure, a few other cardiovascular diseases. So if someone already has those, like if they're coming to see me and they're marking off like, yes, I have diabetes, I'm going to really be wanting to see how are their metabolic markers? Do they have presence of insulin resistance? Because that will be a very strong piece of how I want to address their sort of total plan from a nutritional standpoint. And so in that, it's about adjusting, is there a lot of hidden sources of sugar and simple processed foods? Like, are they aware of the idea of eating whole foods? Are they not really having that awareness yet? And it's about talking about, eating foods that you recognize as foods instead of, just out of packages and boxes. And talking about just where those sources of hidden sugars and carbohydrates come from, and formulating a plan that's usually in these situations higher fat and protein relative to the carbohydrate intake. So yeah, based on their history and their labs and what's been going on in the past, I might have more of a stronger emphasis in that regard. Versus if it's a patient and we're getting more of a sense of like a nutritional deficiency, under eating protein, for example, can for some people, and I see this more in my thinner patients, I would say that typically female patients, in my experience, are a little bit more apt to sort of, I would say, accidentally undereat or just not really eating enough protein that they need to fully regenerate and heal. If it's a chronic injury, chronic ligament injury, for example, that's really causing their pain. Another nutrient that I really like, and I like to sort of be a big cheerleader behind, no matter which camp people fall in, is collagen. And so for any of my patients that will consume an animal product with which collagen is derived from, then I think that's just a really helpful, how I explain it to patients is like, this is a building block of your cartilage tissue, ligament tissue, tendon tissue. All of those are very highly concentrated in collagen. So if we give you a little boost every day, it's kind of like a multivitamin where people will take a multivitamin saying, well, just in case I need a little bit of zinc and a little bit more B's, a little bit more A's, I'll take a multivitamin. Well, that's how I think of collagen for those chronic musculoskeletal injuries. Like, let's just take a little bit every day. So when the shoulder needs to heal, hip needs to heal, ligaments, tendons, wherever they may be, like you have those building blocks already on board so that your body can integrate that in. Because I would say that just typically the US diet, even those of us omnivores, we're not going to get collagen in our diet really unless we make a concerted effort towards it. We don't have the cuisine from other parts of the world that are just naturally high in collagen. We're not eating like pork knuckle soup and chicken feet and things like that, where a lot of Americans might be like, oh, that's weird. It may be not very usual for someone's cuisine, but it actually is really high in collagen. It can be really, really great sources of food. So besides the pork knuckles and chicken feet, I'm usually starting more with like bone broth or collagen powder, or incorporating gelatin as just sort of a recipe that someone is using to kind of integrate a little bit of that in daily.
Awesome. I'm so glad you mentioned the collagen. That was actually something that I was going to ask you about. So you covered that beautifully. I love recommending collagen to my clients, even if they don't have joint pain now. I kind of think of it as like a buffer, and it also helps with the GI lining. It helps with everything. So I'm a big fan of collagen as well. And based on the first thing you said about, someone coming to you with metabolic health problems, that's so interesting because I'm sure people who have those problems but don't really think it's a big issue and have joint issues don't really make the connection between the two. So I think that's so amazing that, you're addressing that, and you're addressing that the metabolic issues are playing into the joint issues, and then going and fixing that through diet and other avenues, which I'm sure we'll talk about in a minute. So I know you have a 7-step plan that you outline in your book, and we would love to hear a little bit more about what that entails and what each of the steps is.
Yeah. So we talked about a few, and so where I start with step one is just understanding someone's diagnosis and not just the label that they may have been given or that the imaging says, but really sort of listening to someone, doing a really comprehensive physical exam, so that I can figure out what I call in my mind the pain generators, like where is the pain actually coming from. And just with the example of knee pain, for example, I would say, gosh, probably the majority of my patients, where the pain is coming from, where they're feeling it, doesn't actually end up being inside of the joint, it ends up being around the joint. But because we feel like it's in the knee area, we just kind of put it all under the umbrella of knee pain. So I pick up on a lot of chronic ligaments, just injuries, sort of inflammation, and that kind of chronic low-level inflammation being the cause of the pain is actually pretty common. So step one is just what is someone's diagnosis, because that's really going to influence, obviously, or I should say, I think it's obvious, but a lot of times patients aren't really given that great of an exam. Like countless patients of mine haven't even been given a physical exam, and they might actually have been in pain for years, sometimes decades, and we just need to, us providers who focus on this, get our hands on that joint to figure out where the pain is coming from, so that we can go on to the next steps to figure out for each individual person what is the right pieces to be put in. Because this is just sort of the framework of how I think. Not necessarily every patient needs every single one of them, but this is sort of the process that I go through. So knowing your diagnosis, nutrition, that's number 2. So that comes very early on in the game. And just because of the huge impact on insulin regulation and inflammation and all of that. Like if we can get that regulated, everything else kind of proceeds a little bit more smoothly. Moving. So is someone moving? Do they have any sort of regular exercise activity? Did they have to stop because of pain? Individualizing. Am I sending them to someone to get like a biomechanic assessment and be observed during like weighted activities? Or am I just doing more of like counseling specifically to what they need and what they should be focusing on strengthening and mobilizing, and what do they not want to go in the gym and do heavy right away? So movement's a big priority for me. And then from there, going into other lifestyle factors, which again is individualized, but I would say like the big topics that are very important for joint healing are stress levels, sleep levels, alcohol intake, tobacco intake. The first 2, we're wanting to decrease the stress often and increase the sleep, and then alcohol, if it's, I would say, quite moderate plus, is just really dehydrating to joint, to cartilage tissue. So getting a sense of if that's relevant to patients. And then tobacco, I would say most people are aware of, quote unquote, smoking is bad. And they might think of like, oh, it's bad for your lungs. But a lot of just those toxins that they put into those tobacco products do end up in the joint tissue. And they've done a lot of really interesting research on this, where it pretty much poisons joint tissue, ligaments, tendons, spinal tissue, like the actual discs. We can find that gunk basically from those tobacco products ending up in all of those various parts of the body. And then from the lifestyle piece, hormones, I'm a big proponent, or I should say, I have a keen ear and eye out for hormonal deficiencies and excesses and those implications on joint regeneration and healing. And depending on the age and again, history of patients, progesterone, testosterone, estrogen are some big ones where, particularly if there's just this lingering injury that isn't healing, plus they may say a few other things that they're experiencing that makes me think, okay, that's potentially hormonal. Do we want to do an assessment? Actually check your hormones for that. And I have patients where they may come to me for one or another, like just this or just that reason, between like, okay, I have some menopausal symptoms. Like I'm just coming in for hormone assessment, or I'm just coming in for chronic hip pain. But over the course, pretty short into my working relationship with patients, they realize I'm looking, broad spectrum across the whole picture of health. And so sometimes I'm ordering hormone testing for a patient who comes in for hip pain. And sometimes a patient who's coming in for hormones brings up this chronic shoulder issue that they've had. I'm like, well, don't hold out on me. Tell me that part too. I want to know about that and be able to sort of address everything there. So hormones are really important for joint healing. I really want to emphasize that because I just don't think that's connected often enough and known about enough. And then I think of the last couple of steps as sort of treatment options that are like the icing on cake after everything else foundationally has been put into place. And that's specific supplements like collagen that we mentioned, glucosamine, fish oil, curcumin. Those are some that I mentioned in the book with the research for what specific types of joint pain and sort of what someone's goal is, like what are they specifically trying to help heal, why some different supplements may be helpful. And I'm going to say helpful instead of like critical or crucial, because if all the rest of that was ignored and someone's just like, I'm just going to see what supplement can get rid of my joint pain, it really often doesn't work like that. And then the very last piece that I talk about in the book and that kind of considers like the last step is consideration of injection therapies, regenerative injection therapies. There's a whole host of them, but prolotherapy, platelet-rich plasma injection, stem cell injections. There's bone marrow, and there's also like amniotic and umbilical injections. And so I just talk about all of that as it relates to joint pain. Again, that can be very powerful, but often needs to be layered in after the whole foundation of health is put into place.
That is such an amazing step-by-step approach and such a great overview. Leah and I have spent so much time talking about sleep and stress and inflammation and how important that all of those components are to every other aspect of our health. So it's just so interesting to learn just another, which is joint pain, that these lifestyle factors play a role in. And it's so interesting because people will skip over that part of your steps and go straight to taking curcumin, and they'll think that's the answer. But if they don't lay that foundation of really improving their health and lifestyle, then the curcumin likely won't be the only answer. Is that right?
Yeah, I see that time and time again. And I very often have patients where maybe we're getting through that and then I start talking about a supplement and they're like, oh, I already tried that. And so I drill them and find out, oh, it's some synthetic form, or it's not very bioavailable, or it was like mixed in with 20 other supplements. So you only got, 5 milligrams, not 500 or something like that. So yeah, this whole supplements and people just on their own picking supplements is often very fraught, and people are just kind of grappling in the dark, not really knowing, trying this, oh, that didn't work, trying that didn't work. But they can, the high quality, high potency ones can be a great tool. But yeah, I really think that you got to get those earlier pieces set, because if there's insulin resistance and inflammation, or we haven't even talked about other things like maybe their gut health is not great, then that supplement is just not going to be absorbed and really used as we would expect the effect to be.
Exactly. I was wondering actually if you could explain the connection between things like insulin resistance and joint pain. Like, how is that connected?
So I would say there's a very general, like, insulin resistance does promote and upregulate other types of just generalized inflammation. So you can see that in cytokine responses, in adipokines, if those are measured. So I would say there's like a global impact, and then there's also a really specific tie-in, and that is with the insulin resistance. And everyone, how I view it is that everyone has our own sort of like genetic predisposition towards where we might start off insulin resistance versus sensitive wise at birth and earlier in life. And then as the decades go on, by and large, most people out there, especially if they're not really, really focused on it, they'll become a little bit more insulin resistant, over time. And that for many people, it can just be, again, if they're really not paying attention to any of this, a matter of time of if they suddenly become pre-diabetic at the age of, 35 or 65, a lot of that there's a lot of environmental impacts, of course, but also our genes play a role. And so as that insulin resistance is developing, there is a greater and greater production of insulin with those meals to try to deal with the carbs getting broken down into glucose. And so we get the high blood sugar happening after meals in this situation of insulin resistance. And so then the body says, well, we don't want the numbers to get too high. We know that's not good. So as with a meal, let's just say one typical meal, not changing over time, but someone's insulin resistance developing, the blood sugar is going up and up and up over time as that insulin response is sort of lagging and slowing down. The body's way of dealing with that is to produce more and more and more insulin over time. And we actually see the joints as sort of this spill off location for that insulin excess. This isn't something that I check in office, but that's something that we see in research, is that they actually take joint aspirations. They take fluid out of people's knees and see that the insulin resistance is seen first in their joints, like that they're it's not insulinemic, it's hyperinsulin I'm not sure. high insulin in the joints. Not really a medical term that I would use, but we can see that before someone becomes hyperinsulinemic, high insulin in the blood.
That is so fascinating. I'm so glad you went into that because I didn't know about the insulin accumulating in the joints. That's really, really interesting.
Yeah, it kind of creates its own sort of cascade, snowball effects there. It's very irritating. It provokes a lot more of those cytokines. And we can actually see this as sort of a connecting loop between whatever fat depots, so any location of fat in someone's body, like near the joint, that's often where a lot of those adipokines, so the cytokines, the inflammatory molecules that are coming from the fat tissue, is sort of the insulin prompts them to produce more, and then they're producing more. It's getting into the joints, and so it kind of goes on and on like that. Yeah, and unless they come to us and get that changed.
Right. I think that also just highlights how important it is that in your steps, nutrition is one of the first two steps, which is so great to lay the foundation. And it also just highlights how everything in the body is so interconnected. So I think that's really awesome. And the steps really lead you to a great foundation to address the insulin resistance first, because that, if you just take the curcumin, but you're still having the insulin resistance, it's not really going to do what you need it to do.
No, I don't think there's any amount of curcumin that can address and reverse that. I mean, of course, it can be part of everything else that we're doing with people. But yeah, I will sort of tongue in cheek sometimes when patients are like, can I just take that supplement over there? I'm like, you can't out supplement a deficient diet or a diet that's not working for you. And if something is getting worse and worse over time, that's proof that we need to change your diet. If the blood sugar, joint pain, things are getting worse over time, we got to change this. We got to start from the foundation and work our way up, because I just see it. Everything else works more efficiently if I can get that nutrition piece dialed in well, versus trying to think about doing some of the later steps without having everything earlier set in place.
Leah, we may have to add insulin sensitivity to one of our topics coming up soon.
Definitely. Great idea, Stacy.
Dr. Angela, will you talk about any additional treatment strategies that maybe you haven't touched on yet?
Well, I would say, and I maybe just glanced over this briefly, but circling around to the third step, which is sort of movement, exercise, I as much as possible try to be a very, very big cheerleader for my patients for getting them to strengthen. So I start with kind of, what are you doing? What exercise are you doing right now? And if it's walking, yoga, something where it's mobilizing the body, mobilizing their joints, I think that's great. And I don't tell patients to stop that, but I do want to often, for most of my patients, layer in something where it's strengthening, resistance, body weight, or weights if that is appropriate. And the reason for that is severalfold. One is if they do have any sort of hormone deficiency, a lot of the strengthening and building up the muscle strength, muscle fibers, basically well-conditioned muscles, do optimize our own hormone response and balancing. So I think of it as like a really nice general foundational piece for good hormone health. And another, going back to sort of the metabolic and insulin conversation, is that if someone's building up their strength, they're building up their muscle, their muscle fibers, like on a anatomic microscopic basis, then they're also going to be increasing their insulin receptors. And that's going to be a very, very strong, impactful piece of improving their insulin regulation. And lastly is that if I can get them to build up strength, then they are going to be distributing the load through the muscles and not just jamming straight through the joints. And so that helps joint health, that helps ligament health. So I'm a big strengthening enthusiast.
You talked about hormones a couple of times. I'm curious, is there a connection between menopause and joint health?
Yes. Yep. Big connection. And where we see that is, so I guess I'll start off by saying with osteoarthritis, degenerative joint disease, like, yes, we see increased incidence of that through the decades, people getting a diagnosis at 50, 60, 70, 80 on up. However, specifically through like that menopausal transition year, and for the next about 5 years, we really see a spike in women getting a diagnosis of degenerative joint disease in the knees, in the hips, and also degenerative disc disease in the spine. So we see a lot of that jump up, and it is inversely correlated to the estrogen levels. So estrogen declines, and a lot of those degenerative processes, estrogen goes down, and those go up. So we see that like very, very close association there. I can definitely see that sometimes in patients that are younger, that are older than that. But yeah, I definitely have a keen eye for my patients going through that, for us to do what we need to do to optimize that, to test their hormones if we need to check and see what those levels are, just because of that known association there, that it's not just age. As the years go by, it's the slow and steady. For women, it's not. For men, yeah. But for women, it's not. It's that, yes, there's a slow and steady incidence over time. And then through menopause, it's this really sharp jump in some of these. Basically, the muscles, ligaments, tendons suddenly not getting that estrogen circulating to the degree that it was previously. And that really shifts our sort of, I think of it like a teeter-totter of degeneration and regeneration. So without that estrogen there, more of that degeneration is happening and not getting balanced out by the regeneration processes.
I know this is a huge topic, but may I ask what your feelings are about hormone replacement therapy?
I was just going to ask the same.
So I think it should and always be like a big topic and a long conversation. I don't have I'm not like on either extreme. So I definitely see that there's providers out there that are extremely cautious and think that basically hormones should never be used. I don't necessarily know that anyone and everyone needs it just because they may need it at one point. I tend to think a little bit more pragmatically and practically, where for some people it can be a good option. Again, if it's layered on top of a really smart plan that includes nutrition, that includes movement, that includes all these other things, then I can, and I do for some patients use hormone replacement therapy at we can get away with smaller doses and they're doing really well. And it doesn't have to be this big, high walloping dose that has often been used historically, because their body is working really well and is very sensitive to the signal of the hormones. So I think of what I see as the negative research on hormone replacement therapy is I see a couple of really big errors, and I don't know, and I think maybe part of it was ego, but using big high doses of synthetic forms of estrogen, and the biggest thing I see for any of those negative research outcomes is they really just weren't checking in with the women. They're like, here's your hormones. Okay, you're not complaining about hot flashes anymore. Have a good life. And just giving them that high dose of hormones indefinitely and never checking up. And I just don't think that's good medicine. I mean, anything I'm doing with patients, I'm wanting to see, is this working for you and how is it going? And if it's something where we do have to monitor labs to do that. So I think they can be used in ways that will actually improve someone's risk for chronic diseases. There is research out there that it can be used in a way that actually lowers risk for like cardiovascular disease, dementia. Like I see it can be used in good ways. And then we can see in the research, it can be used in bad ways too. Mm-hmm. Probably my favorite book on this topic is Estrogen Matters. And it was written by a breast cancer oncologist and a social scientist. And so, yeah, for patients that want to really like dig through and read a lot of, well, why are some people pro and why are some people con? And why are both people saying that their view is research backed? I think it's a great book.
Thank you for covering that. And I definitely need to check out that book because I know there is so much on that topic. But I love that you have such a balanced view of it. And like you said, your ego doesn't get involved. You just look at the research and, make your decision based on that, which is what we should all be doing. So that's awesome. Is there anything else that you wanted to cover? I know we went over a lot, your whole STEP program and all of that, but is there anything else that you feel like would be helpful for our audience to know? I think just overall, it's really amazing to know that if you are having joint problems, it's not the end of the world. There are things you can do. There are different therapies. So I think it's wonderful that you're sharing that. But is there anything that we didn't cover yet before we close out that you wanted to touch on?
I would just say the one I guess the one view I want to leave everyone with is that just keep going. That I would say that there's a lot of sort of feeling stuck at the end of the line, a lot of hopelessness when it comes to chronic joint pain, because like we mentioned previously, something doesn't work. And then maybe they're not a surgical candidate, or they're adamantly refusing to even think about that. Or what actually commonly happens with a lot of my patients, they're told they're not quote unquote bad enough yet. Like you got to go back to the surgeon in 5 or 10 years. So they're like, well, what am I going to do for the next 5 or 10 years? You're giving me nothing right now. So I would say like, just keep going, just keep looking into it. A lot of the research, the whole back section of my book is all the research citations, and most of those have actually come out within the last couple of years, and a lot of them were actually even published earlier this year in 2020, that had just come out when I was writing the book and published it this past July. So our knowledge and our awareness and the scientific understanding is like exploding right now, and just because you were told there's nothing you can do about it, last year or 5 years ago or something like that, just keep looking into this, keep researching additional avenues that you haven't investigated, because there's a lot, and it's kind of brand new, and it's a really exciting new frontier. There's many options now.
We're doing a book giveaway, but I am going to let Leah describe the details because I am still not Instagram savvy yet enough to explain this correctly. But I did have one last question before that happened. Do you have any success using bovine tracheal cartilage as a supplement for joint pain?
I will say I'm not sure about any experience using that source.
Okay.
I do know that some of the companies that I've used for recommended for collagen supplements have been using chicken sternal cartilage. No, but I'm not aware of that one specifically.
Okay. Well, I'll send you a link to the website because I do use some of their supplements. I've had some bone and joint issues in my life as well, and they've been really helpful for me personally. So maybe you'll be interested in the company. The one that I order them from is called Ancestral Supplements. They're actually a really interesting company if you look at their website and see how they source their products. So I'll send you a link. It might be something to look into.
Yes. I'm as you can probably tell, I'm always looking into new things. Always loving to research and just kind of looking into the sourcing and information that we can get, so that we can continue to evolve and find out what works best for everybody.
Yeah. Well, before she goes, I'm just going to say thank you so much. Thank you for connecting nutrition to joint pain. That's huge. I like I said before, I don't think people even realize that is connected. So thank you for coming on. I've learned so much from you. And Leah, go ahead.
Yeah, thank you so much, Dr. Angela. And Dr. Angela has also been so kind to offer a signed giveaway of her book, Younger Joints Today, in conjunction with this podcast appearance. So we will be doing that giveaway on Instagram. And in order to enter, you just need to follow the Power of Food podcast and Dr. Angela Cortal on Instagram. And then we'll be posting about this podcast. Like and comment on the posting, and that will enter you into the giveaway for a chance to win that book. So hope you all enter. It'll be chosen at random, so you have a decent chance at getting it. And as you can tell, Dr. Angela is so knowledgeable about this, and you'll learn so much from the book. So especially if you're dealing with joint issues or anything like that, or someone in your life is, this would be an awesome opportunity to get that book. So thank you so much, Dr. Angela. We're so happy that you joined us for our 10th episode, and really appreciate you taking the time to come on the Power of Food podcast.
Well, this is so fun. Thank you for having me.
Have a nice day. It's nice to see you guys.
Thank you. Bye-bye.